Hi, good morning, Mrs. Haberman. I'm glad you could come in this morning. We really need to discuss a few things regarding your options as far as kidney replacement therapy since you're having some problems. Basically, since you've had diabetes for so long and you've done such a great job of managing it, it's just that at this point your kidneys are getting kind of tired and they're starting to filter out some things that they should be keeping in, and they're starting to not filter some things that they should be taking out. Okay, so we know this for a couple of reasons. First of all, you have heavy amounts of protein in your urine, and secondly, which should be left in the blood. Secondly, you have a low glomerular filtration rate, which is, or GFR, which is the test that we use to measure kidney efficiency, okay? Yours is right around 29 milliliters a minute, and usually it should be up around 90 milliliters a minute, so it's pretty low. Okay, so we have a few options. I'm going to discuss them all with you. First of all, your first one is called hemodialysis. You've probably heard of it before. In this process, you basically have regularly scheduled appointments every week to go in and have a dialysis machine that would basically act like a giant artificial kidney, okay? The process would start by creating an access point. You're right-handed, correct? So to go in your left hand, your left arm, and it would be done by connecting an artery and a vein, so you'd have a point that was strong enough to have blood entering and leaving during your appointments. Okay, so here's kind of what it looks like. And each time, this is the dialysis machine, and she's hooked up to it. But basically, each time you go in, it would take about 3 to 5 hours. You probably go about 3 times a week. And while you're there, you can read and watch TV, talk to people on the phone, whatever you need to do. Some people nap. But basically, it's really common. A really common treatment. It doesn't hurt. The process itself doesn't hurt, and there's medical staff checking on you, your heart rate, etc., and your blood pressure throughout the session. There are a few side effects and risks. I'll make sure you get a pamphlet that explains all of this, but during the treatment you might get nauseous or have abdominal cramps, but that's completely normal. Usually your diet and medication can be altered to reduce some of these side effects. Since there are also a few other things: low blood pressure, shortness of breath, and if you're nauseous, there's a risk of vomiting. Sleep problems can occur, usually a type of restless leg syndrome. But high blood pressure can also be a problem, especially for a high salt diet. But since you're usually pretty careful about that, I'm not too worried about it for you. You need to make sure you drink the right amount of fluids, though. And there's also a risk of infection but those can usually be resolved with antibiotics. After a while, some patients can develop a condition called amyloidosis, which basically is where you have proteins that are deposited on your joints and tendons. It can cause some pain and swelling. Basically, you just need to keep up with your appointments and make sure that you're always telling medical staff exactly what you're feeling, and if you're feeling anything uncomfortable or different than you have before, they need to know. Okay, so the next option is similar. It's called peritoneal dialysis. And basically, instead of having a machine, you have a bag like this full of dialysate, and what happens is you make it an access point into your peritoneal cavity, and the fluid fills into that cavity. It takes about 15 minutes to fill up, and then you leave it in there for about 4 to 6 hours, and eventually the waste products that are in your blood diffuse through and end up in the fluid, okay? And then the fluid, you drain it out and then replace it with new fluid. This can be done while you're sleeping. That's called automated peritoneal dialysis, or you can also do it yourself, where you change the fluid out 4 to 6 times a day. And just keep the fluid in there at all times and then change it out. And that gives you a little bit more freedom. The equipment for this is a little bit cheaper than for doing regular appointments with the hemodialysis. However, there is a greater risk of infection, so there are rising costs there that are involved. However, the peritoneal dialysis is a little less efficient than hemodialysis, but you're doing it every day, so you have less chance of waste buildup than you do with hemodialysis. However, there is greater risk of infection both in the peritoneal cavity as well as in the site where you have it entering. But there are a few other risks, including low blood pressure, back pain, and hernia. And you would need to constantly maintain your blood sugar levels because the dialysate does contain sugar and can interfere with that, and there isn't a way to monitor it through the actual tubing, okay? Any questions about that? Okay. Final type of renal replacement therapy we want to talk about is getting a kidney transplant. And I know you've expressed fear about surgery in the past, but I really do think this is probably your best option. And here's what would happen. Okay, so we basically find a matching donor, whether that be a live donor or a deceased donor. Since everybody has 2 kidneys and you only need 1, you can actually have a live donor. So if there's somebody in your family who's a match for you and is willing to donate a kidney, fantastic. Otherwise, we can put you on the deceased donor list to get matched with a deceased donor and hopefully receive a kidney. Basically, the best thing about this is that it would give you 10 to 15 years of freedom from this kidney, and then at that point you would be able to choose whether or not you wanted another kidney transplant and stay on dialysis for a short time between, or if you wanted to start dialysis, that kind of thing. So you have 10 to 15 good years with this kidney, most likely. There are a few risks involved. Sometimes rejection does happen of the transplanted kidney. You would have to stay on immunosuppressive drugs at least for a while after your initial surgery, about a year. There is a greater risk of several things due to these immunosuppressive drugs, including getting sick since your immune system is limited. They do sometimes cause a specific type of lymphoma. It's pretty rare, but it does happen. The other side effects include GI irritation from the drugs, weight gain, high blood cholesterol, and osteoporosis. Again, all of these side effects are mostly from the drugs, not from the transplant itself. So the surgery itself takes about 3 hours, and here's kind of what happens. Here are your kidneys that you have now, okay? And they would stay in there because it's much harder on your body to take them out than to just leave them in. And the new kidney would actually go down here and be attached to this main artery and vein, and then your ureter would then be, from that kidney, would then be attached to your bladder down here, okay? So it's pretty exciting stuff. That new kidney would last, like I said, about 10 to 15 years, and then we could discuss options later at that point. But you have these options. Let me know if you have any questions. You can always call my office, and I'll get back to you as soon as possible. Each of these options has worked for thousands of people, so you really need to just take into consideration everything that I've told you and make the best decision for you. Okay? All right. Discuss it with your friends and family. Let's meet next week and see what you've decided, and we'll take our next steps. Sound good? Okay. Thank you. Take care.